this because we did do a live during aftercare, and you guys got all very concerned for our patient who underwent a big transformation. She first off, she's like, I treat her like she's my family, so I was not concerned at all. I've done this for many years, and our plastic surgeon and myself work extensively together to make very large transformations. So my patient here, if you see her before, I'm gonna cover her face for a second. This is how she looked. She's beautiful. She has the most amazing structure. But what happens with aging? You get fine wrinkles. You could see that was highlighted on her under eyes and around her mouth. You could see there's a lot of laxity, even sun damage throughout here, and loss of contour of her face. Even her lip was starting to disappear. And I'm going to show you guys on the 45-degree angle. You see the jowl formation. You see the heavy folds. You see the brows coming down and the lips. And this is normal for aging. In fact, I'm 43 and considering doing the same treatment actually this year as a preventative treatment. She waited a little bit longer. We have done lasers before to get some enhancement because we never lift dirty skin. That's what we say. We basically need to prep the skin with a lot of collagen. But I want you guys to see her now only a week later. Now, when you do a large treatment like this, you guys show show the 90 because I think it's really important for them to see. She had a lot of looseness. I'm gonna show here. Let me go to the other angle here. So she had a lot of looseness in, I'm gonna pull this here, in her platysmal bands and the lower face. I'm gonna go like that right now. I wanna show you guys something. If I pinch, I literally cannot grab anything. This is so tight. Yeah, there's a little bit of swelling, but you cannot say that this scar is perfectly well hidden, will not be seen. Same thing for the blepharoplasty and the lip lift. You guys could see a scar hidden. Even the temporal lift right now a little accentuated. It will all settle in. It's all a part of a process and understanding and trust because this treatment is a large treatment. And not only is it surgical enhancement, and I'll show you guys again this 90 degrees. It's also laser, which requires it has a lot of swelling and healing, and injectables, nano fat and regenerative injectables like Sculptra and Renuva to help not only lift the temple and fill things out, but also contour. Like we want her face to have volume because look at the before, even right through here. You could see the brown spots and wrinkles, but look at the hollowing in the center of her face and look at the heaviness in her folds. Look at also that fine wrinkling and stuff. But now look at the smoothness and beautifulness. I mean, the radiance basically of her skin. And I want to show one other thing before we go to the questions. Look at her lip, okay? Let me zoom in around the mouth because this is a big area for women, especially the fine wrinkles through here and then loss of the lip volume. But now when the lip is lifted, take a look at how much more contoured it is and how much softer it is, and then look at the lift through the mid-face, not only with the fat injections, but also the lift itself. What questions are they asking?
So get a facelift. How do we maintain it?
So maintenance requires energy-based treatments, and I always tell people every quarter doing something to tighten and brighten the skin. That could be microneedling radiofrequency with laser, ultrasound a few times a year. She's obviously not going to need threads because we just did threads. That's the face and neck lift, but she didn't just do a facelift. We did face and neck lift, we did brow lift, we did eyelid surgery, and a lip lift. So that's a lot in one session. But we also, on top of that, did laser, and we did face, neck, and chest. And I even did some injections of Sculptra, which helps build collagen throughout her chest, her entire face, temple, and scalp, and along her jawline and around her mouth. That's going to help build collagen over time, and so that she won't get these fine wrinkles coming back. The other thing I want you to see is look at her eyes. Let's focus on that. This is where our plastic surgery is really phenomenal. So she had good brow height, but it was causing still, there was some droop, lost volume, and you see the upper and lower skin. What we did now is it's a little more accentuated, it will come down, is a little bit more of a lateral lift, more tightening, and look at the softening to the eyes. This is really gonna open up. People are gonna be just sort of enthralled. They're gonna just like want to go towards her. Her eyes are gonna be so inviting afterwards because they're open now and they're more lifted. This is the look a lot of women are going for nowadays, where it's a more natural lift, but again, it's that very sexy, open, very youthful looking eye. And especially with the fine wrinkles being gone, she's just back, I think, at least 20 years. What do you think in terms of aging? How do you
I
think?
was hoping for 15, so when you say 20,
She's
that's a win.
happy. So
Yes.
15, we did. So we always over promise, under deliver if you need to, but we try to over promise all the time, or under promise, over deliver, which is what we did.
Yes.
So this is really the result, you
Precision
guys,
care.
and I know a lot of people were nervous because when we do these types of treatments, especially with laser, there's a lot of swelling. And so I always tell people that swelling is going to come down from your forehead. So it goes to your eyes and your lips. And that's why on day 1 or 2, when we did that live, her lips were huge because it's all swelling from the lip lift and everything falling from the forehead. That is normal. And I know people are freaking out, but you look at her now a week later. Honestly, by 2 weeks, it'll be almost unnoticeable, to be honest. It'll look very minimal. So I tell people 2 weeks of social isolation, 3 to 4 weeks before going to main events. That's what I tell people. And if you were like a newscaster or a celebrity or on TV, 4 to 6 weeks, no one will know. 2 weeks socially, unless you care, isolated, and you'd be fine. So she's doing aftercare with massaging, hyperbaric therapy, everything that we need to do for the skin, and that's why she's healing so quickly. So I'm going to show you guys again one more time. Let me show you one more time the before. So I'm going to do the front view, okay? Now let's show the 45. So turn a little to your left, just slightly. There we go, the 45. Okay, let me show that there. Beautiful. And then let's show the 90. You can go on the other side if you want this time. Turn towards me a little bit. There you go, right there. Perfect. It's just incredible. I'm so excited. Again, the first 3 days are the most important preventing complications and making sure we're seeing the best results. After that, it's smooth sailing. It's just taking it easy. How was the recovery so far, would you say?
Well, it was great because I went to a nice aftercare facility, which
I
I
think
highly
that's very
recommend.
important. I know people think that's like adding on and it's expensive. I understand, but you really shouldn't be doing this more than once or twice in your life, depending on when you started. If you started at my age in your 40s, you may want to do it twice in your life. But if you're starting a little bit older in middle life, 50 to 60, you're probably never going to have to do it again. So it's the one time you should choose to do everything that you need to recover and feel good, because otherwise it's a lot on your body to handle.
It's a lot.
And so I think the aftercare and doing all the skincare and all the follow-up stuff in our office is really important. So I'm very happy to showcase you guys a week later. Thank her so much. Right on Instagram, thank her. And we will continue to follow her because she's my patient long-term and she's going to look incredible. I'm very excited
Thanks,
about it.
Dr. Emer.
You're
So
welcome. I love you.
excited.
Can't,
Thank
can't touch you
you.
too much, but I love you. Any questions you guys have had, DM us. But we're going to do a little pan to show you how she looks, and we're just going to continue to follow. She looks incredible.
Thank you.
It's great.